Nō reira, tēnā koutou katoa. Kia ora everyone, and welcome and thank you for coming along to this talk. I'm talking about two of my absolute favourite topics, which is acceptance and commitment therapy and ADHD. Firstly, because I have ADHD, so this is a topic very close to my heart after growing up with ADHD and experiencing difficulties along the way, and utilising acceptance and commitment therapy in my own life firstly, and using it for many years in my own practice and with lots of whānau with ADHD. Lots of kids, youth especially, and working with lots of whānau in quite a integrated way. With I like to work with whānau as circumstances allow, rather than focusing on the kids as individuals. And that's certainly the approach that I've taken in terms of my research as well, which I'm going to talk about quite a bit. Please let me know if you can't hear me. I've got a wee bit of background noise, but my office is absolutely stifling, so I try to keep my window open. So I'm going to share my screen with you firstly, because having ADHD, like to have a really integrated approach in terms of having visual slides. Is that okay for everybody? Cool. Give me a wave. I can only see a few of you. So Fee, can you see that okay? Cool. Fantastic. So I want to talk a little bit about why acceptance and commitment therapy. And I think that's really important in terms of why I came to this approach. Fee mentioned that you know, a little bit about my background, and I think that's important to position myself in terms of who I am. And as a clinical psychologist, we often don't talk about our identities, but I think that's we're starting to do this more. I currently teach into the Masters of Counselling program, and we are awfully big on identity broaching. So I'm a cisgender, straight, Pākehā female, and I've come from working class origins. I have a neurological disability, so if I sometimes struggle with word finding, that's why. You'll have to perhaps give me a little bit of patience if I struggle with word finding. I come from Irish, Scottish and English Quaker background, so that's a bit of an unusual mixture in terms of working that one out for yourself. And also bicultural whānau. So growing up in Te Whanganui-a-Tara, my aunts and cousins hail from Tūhoi and Ngāti Toa ancestry. So I was really privileged to grow up quite embedded in their culture. And I was, you know, so received their guidance still in terms of navigating a bicultural path. And that certainly has quite an impact today in terms of my practice and also research as well, but also how I live as a bicultural ally in Aotearoa. And I don't sort of come from a typical Pākehā background in terms of my ancestry. So my mum was born in India, and my grandmother was born in China, and my dad was born in Fiji. So sort of had come from a long line of travellers. And so it's important to me in terms of cross-cultural broaching and taking into account where people stand, and also where family of origin come from, and also context is very important to me. So that's really deeply embedded in ACT, or acceptance and commitment therapy, which I'll talk a little bit more about. So in terms of why I fell into ACT, or acceptance and commitment therapy, so I mentioned context is really important. For me, there's no right way or no one truth. And I really found it really hard in my sort of clinical psychology training when we start to think and talk about wrong thinking or incorrect ways of thinking, or approaching rational ways of thinking. And so I really struggled with this, especially when I was working with people who are approaching end of life journeys. And so I worked in the hospital for a number of years. I worked in palliative care and also child oncology for a couple of years as well. I've worked for a number of years because I started off as an investigative social worker and continued to work for a number of years with individuals who've experienced quite severe trauma. And so I didn't find it okay to pathologize experiences or talk about these ways of right or wrong ways of looking at the world, or these ways of thinking, right or wrong ways. That sort of black and white way of viewing our well-being, or right or wrong ways of abnormal psychology, just never fitted well with me. I really like positioning relationships as everything. That fits well with my values. I don't think therapy should be so rigidly manualized. I also think there's so much knowledge and wisdom that does not come from Western psychology, and I think we need to be honest about that as well. And rather than just appropriating that knowledge and wisdom as well. I also really struggle, have for many years, with written homework. If I found that really hard from my ADHD brain, why was I asking my clients to, fill out so much written homework? Here, take this worksheet home and complete it. I found that my clients really struggle with that, and I really had a hunch that I would never complete that homework. So why was I asking my clients to do something that I would never do myself? So I'm going to do a really brief overview, firstly, about what ACT therapy is and what it isn't, and just very lightly cover some of the theoretical constructs around it. I'm not going to go too deeply into the theory. Before I go on to what ACT might serve for us in terms of children and whānau, before I touch on what we're doing research-wise, I'm conscious of how much time I have as well. So what ACT isn't, it's not a territory in Australia. It's not the political party. It's not the answer or the modality, despite the fact that us ACT therapists are very enthusiastic. It's not a cult. And it doesn't necessarily, it's not necessarily the right fit for every therapist or practitioner, and it's not necessarily the right fit for every client as well. And I want you to think about who might ACT not be a good fit with in terms of every client. And so we need to think about the fact that ACT has a lot of metaphor. It can be very abstract, it's very collaborative, and it's very non-directive. So if you think about certain clients who, would like your content to be more concrete, who prefer a more directive approach, this might be quite uncomfortable. Yeah. So if we need to be really adaptive to our clients' needs and making sure that we are choosing a modality that suits our clients the best, I might not necessarily use an ACT approach with every single client. So there are some clients for whom this is not a fantastic fit. And I can talk more about that at the end. So what is ACT? It's an acceptance of suffering, which sounds a little odd, but again, I'll talk more about that. Now, it has a certain philosophy at its base. Suffering is based on language, okay, and how we rigidly hold to our language. So, for example, if we are continually using things like my life should not be this way, I should not be feeling this way, that often leads to greater difficulties with things like lower mood, or I shouldn't be experiencing this, so I'm going to try and avoid it or escape it, which often leads to an increase in anxiety. So we also focus on context in ACT. That's a really big part. So what is the context in which this behaviour is occurring? And a really key part of ACT is psychological inflexibility. When we are too rigid, when we hold on to words too tightly and try to avoid feelings. ACT isn't a set therapy. As I mentioned, it's based on a philosophy of science and some assumptions. So often when people learn ACT therapy for the first time, there can be a bit of greater discomfort for ACT learners, because it's like, well, where is the manual? Give me the manual. Often when you learn modalities like cognitive behaviour therapy, there are lots of manualised approaches. There's CBT for anxiety, there's CBT for depression, and then you'll get into session 1, session 2, session 3, and there's greater comfort in learning CBT for the first time, for example. I know that was the first, modality that I learnt in depth. So ACT feels a lot wobblier when you first learn it. But one of the great things about it is its flexibility. It's not a cookie cutter approach. And that means that you can be creative, and it means that it doesn't treat humans like one size fits all. One of the other great things about ACT is that there's no us and them. So how we learn ACT is by experiencing it in your own life. What does it feel like as you experiment with psychological flexibility? So we learn the model and the theoretical foundations ourselves first. And we practice looking for psychological flexibility in your clients' experiences and in our own. Okay? We develop the skills to help our clients increase their psychological flexibility, and our own, I should say. So I say what this course is not. Well, this presentation is not an advanced ACT workshop. It's really just a brief overview, okay? And when we're new to ACT, it's really important that we don't start off by going, okay, I'm going to learn this model and I'm going to apply this to all of my clients all at once. It's really important that we take a gradual approach, because it's a philosophy of science. We want to take this really slowly and gradually. So often when we start with a new modality, we can get enthusiastic, and because this is a new way of thinking and doing, it's important that we do things slowly and carefully with great care. So we often say things like, do quite a bit of training and start with perhaps a client that you're relatively familiar with, and start 1 or 2 new tools and techniques with their consent. Okay, so I've been training in this modality. I wonder if this would be helpful now that you're struggling in this. We've been talking about your struggles in this area, and what we've learned around when we, not you, when we try to avoid this feeling of anxiety or worry, sometimes that feeling gets stronger. So we avoid it, it gets stronger. We try and escape it, it gets stronger. What would happen if we did some things to notice and accept it more? How about we practice an activity that actually is a noticing activity? How do you feel about us taking a different approach? So some way of bringing in ACT therapy that is gradual for you and your client, rather than turning everything on its head. and completely changing what you're doing all at once. Yeah. There are lots of different sort of ACT versions out there. There's brief ACT, focused ACT, which is designed for obviously brief sessions of ACT. There's DNAV, which is for youth. There's the ACT matrix. Clinical relational frame theory is like the theoretical underpinnings of ACT. I'm not going to focus on all of that in our session today because we don't have time. But I'm just going to briefly do a bit of an overview. Okay. The reason why it's got quite a strong following ACT is because we've got a bit of a problem in terms of what we're using at the moment. Okay. What we're using isn't really working too well in terms of our mental health crisis. Yeah. I'm not saying that a new modality is going to solve all of these problems. There are systemic and social and historical issues in terms of what we're dealing with. There are structural issues. There are significant issues around poverty and housing crisis and inequities as well. However, what we do know is that our current management issues aren't working terribly well. Yeah. The interesting things as well in terms of the standard treatments that I was trained in terms of cognitive behaviour therapy are being reworked. So Judith Beck has just produced her latest book. I'm just trying to remember the name of it. Basics and Beyond, I think it's called. And now she's integrated ACT therapy into it as well as solution-focused therapy. So she's taken out cognitive restructuring yes, and integrated more in terms of a key part of acceptance and commitment therapy, which is diffusion, which I'll talk a little bit more about, and taken out cognitive restructuring. So there's been an acceptance of third wave, what we call third wave therapies, including acceptance and commitment therapy, into more standard approaches, including cognitive behaviour therapy, which is great news. And that's because ACT is based on great research. We also need to acknowledge that none of this is new wisdom. ACT was repackaged as a new third wave therapy. We also have to acknowledge that it's not new. It's based on Taoist and Buddhist principles, been around for thousands of years. Repackaged by Steve Hayes. Did a great job at explaining and translating into Western psychology. But I've studied Kung Fu for 8 years, and my Grandmaster of Kung Fu will often sit there going, yes, yes, Mairin, yes, yes, nothing new. So, this is old wisdom, new to Western psychology. But I think it's really important to acknowledge that ACT is not new. But new and fresh and exciting for Western psychology and for us psychologists. The refreshing part of it, or parts of it, is the contextual approach. So focusing on psychological inflexibility. So when we think about mental health difficulties arising from psychological inflexibility, and oops, sorry. Oh. Oh. And that we need to focus on greater psychological flexibility, that if we can build greater psychological flexibility, that if we can use our, sorry, skipping forward too quickly. Yes, there we go. Yeah, so start again, apologies. So we need to think about how our behaviour is controlled by our internal experiences. So our thoughts or emotions is fact, or by the avoidance of these internal experiences. So I should have psychological inflexibility up there, apologies. So the aim of ACT is to reverse this rigidity by increasing psychological flexibility. So we try to work with our clients to create a meaningful life while accepting the inevitable pain that goes with it, which seems like a contradictory balance, but it's a really important one. And it takes quite a gradual process. So that's what I mean around, it's a different way of seeing the world and living as well, a different philosophy. So often people think, okay, we're just going to focus on the tools and the techniques, give me the manual. But actually that's the challenge of using and learning ACT yourself, as well as applying it with clients. And that can be the challenge, is that you're explaining a different philosophy. And that's why it can take quite a while to learn ACT, learn it yourself and apply it with clients. So some of the core principles around ACT, it's transdiagnostic. We don't really get caught up too much on diagnostic categories. The same underlying difficulties cause all mental illness. That can be a challenge to get your head around. It's very process-based. Non-pathologizing. We all climb our own mountains, which I'll get to that metaphor in a minute. There's quite a strong overlap with solution-focused therapy because ACT was developed in a similar research-based process. There's a really strong focus on workability. There's an issue or problem in ACT only if it's a problem for the client. So we don't say that's a problem, or we don't pathologize, only if it's an issue for our client, if it's causing problems for them. I mentioned pain and suffering. This is a core philosophy or underpinning issue. And obviously this will be familiar for those who practice Buddhism or Taoism. Pain is accepted as a normal part of living. We differentiate between clean pain versus dirty pain, which sounds like a really funny or strange metaphor. But we describe this process with clients that if we can accept pain easier or be more accepting of it, we have a breakup, there's pain, or something happens, we can accept fear, sadness, guilt, shame, anxiety, then we don't tend to double down with suffering. Things like, I can't, what's wrong with me, why do I always do this, or anger, or why me, and engage in other behaviors like isolating or eating or Netflix or the cognitions around avoidance or escape. So that's what we mean by differentiating between pain and suffering. These are core concepts for ACT. The other one I mentioned was climbing our own mountains. This is a really important part. We engage in ACT as much as our clients do, and that dual process is a really important part in therapy. We are engaging in it in our own lives and in the therapy process as well. There's no us and them. We all experience suffering. We all get trapped. The two mountains metaphor means that we are climbing our own mountain, and it's not that we are able to solve our clients' mountain climbing. It's just that we have the perspective that we can sort of point out, look, if you just climb a little bit further to the left, there's another handhold, or you'll be able to take a rest, or where there's a little bit of clarity in terms of their route finding, simply because we have perspective, not that we have all the answers or that we know exactly what it's like to climb their mountain. Perspective gives us insight, not that we are able to be superhuman or that we have climbed theirs. This also relates to the concept of not asking our clients to do anything we wouldn't want to do, a little like the homework that I talked to you about earlier. Oops. Now, the ACT hexaflex describes core processes that are underpinning the theory of ACT. I'm not going to go into these just because we don't have enough time, but if you undertake a bit more training in terms of ACT, these will become really, really important and really familiar to you. I just want to highlight some really key ones. Acceptance, really important. So is diffusion and contact with the present moment. And important parts around this is that you can focus on any parts of this hexaflex and there'll be an impact on other parts. So they are connected, each aspects of this hexaflex. So what about ACT with kids? This is really important. ACT was developed for adults. ACT with kids is a newer area. Now, ACT with kids, there are some really important aspects. The tools aspect is that we tend to focus on things like moving ACT. Yeah, so things like, how do we make this kinesthetically based? Moving ACT, we do things like blowing bubbles to focus on breathing mindfully, belly breathing with a toy. We use things like yoga or Tai Chi. How do we engage with the present moment? Focusing on noticing ACT, grounding tools. We use temperature, texture, colours. We have a big focus on naming emotions, really obviously important for emotion regulation. There's a philosophical element still for kids because we want to start teaching early acceptance, learning to not avoid or escape pain, and focusing on the fact this is really countercultural for kids. This is going against the grain for them. And early diffusion. Apologies. Yep. Yeah, so ACT is it's a huge topic. Apologies, there's a lot to cover, but I'll keep going. So in terms of kids, this is quite a new area. Tamar Black has developed a kids program and has put out a book, Kids ACT, and the ACT Kidflex, Kiddiflex is from her book. It's a simplified version of the hexaflex that I showed you, but I struggle with this a little bit because I don't find it too much of a simplified version. What I like about this is that the focus on letting it go and letting it be, and noticing. The aspects of the Kiddiflex that I sometimes struggle with kids is choosing what matters and doing what matters, because I do find that concepts around values tend to be a little bit abstract for lots of kids. Developmentally, it can be a little bit beyond lots of kids. The great thing about ACT is that it's very flexible. So we can really just focus on aspects of the Kiddiflex. So if you're working with kids and all you do is focus on mindfulness, acceptance, and diffusion, so staying here, let it be, let it go, noticing, that's fantastic, that's ACT. Values are optional and can be built on as kids get older. So there's lots of chat about whether values can and should be brought in to working with kids. And I'm not going to answer that today, because that's a philosophical discussion. It's a developmental discussion around when kids are ready, and obviously that totally depends on the child that you're working with as well, and the context that they're in, and whether it's of benefit to them as well. But just know that part of the kiddie flex is optional, and whether it's relevant to them. But for me, I really absolutely focus on the noticing, letting it go, letting it be, and staying here as the key aspects, the key tools for kids in terms of emotion regulation, cognitive regulation, behavior regulation, as fantastic resilience, protective factors for coping with the world. In terms of how does it help? Does this help? Context as an element of ACT is fantastic. It's a really key aspect of ACT. I don't think that we can understand a personal behaviour without understanding their context. And there's great evidence for the use of ACT in a wide variety of populations in many different countries. And even though ACT was developed overseas, there's emerging evidence that ACT is acceptable and effective for Māori and Indigenous clients, and it's helpful for a really large range of problems. And I mentioned, even though it's a challenge, the inbuilt flexibility of ACT is actually quite a strong strength as well. So I talked about how there's all these different models in terms of, DNAV for young people, and I've received training in DNAV. I really like the model. For younger kids, as I've just mentioned, the Tamar Black's version for the younger range. But I also mentioned what about working with whānau Māori, because lots of the ACT training I've received from overseas, there's that sort of inbuilt assumption around therapeutic alliance will just come. And that's certainly a really a big part of brief ACT and FACT. It will just, we can rely on building therapeutic alliance as we go. And I strongly object to that. I don't think that's really appropriate. That skips over whakawhanaungatanga. And there are also really key aspects of ACT that we need to be careful around when it comes to things like things like storytelling around mountains, or understanding the importance of stories. We need to be thinking about how much we bring in whānau, or versus just focusing on individuals. And so when I started engaging in research using ACT, that was a really important aspect. Is like, how do we have this fantastic program and modality? How do we make sure that we're not recolonizing with another modality and making it safe, making it appropriate if we're using it in Aotearoa? So that leads me to Mindkiwi. So Mindkiwi is a mātauranga Māori integrated ACT mindfulness program. So it has been developed with Dr. Kelly Takao, who's in the top right picture, and Catherine Whitehead, who's one of my colleagues, a clinical psychologist. It's been a co-constructed program, and Jace Tapatu contributed Māori yoga as well. He's got a big part in terms of the kinesthetic movement aspects of Mindkiwi. And the really important parts of Mindkiwi is that there's very little writing, there's not so much sitting. Pūrākau, storytelling, are really vital aspects of it. The pūrākau stories are local based stories. Being a researcher with ADHD, but actually one of 3 researchers with ADHD on the project, we have a very strong attention to what might work. We originally developed this program to be a group-based program, so that we could run this with whānau together, face-to-face, so that we could have a group of adult caregivers running consecutively with a kids group over 8 weeks down here in Aotearoa, Christchurch. And then that fell apart over COVID, and we tried to run it twice. That coincided with 2 lockdowns. We also realised at the time that we were getting lots of inquiries from whānau throughout the country who had great difficulty accessing any kind of service, and they were struggling with their kids with ADHD. So in rural areas or in service areas for which there was very little provision for whānau. So we thought this, and there was lots of discussion about, of course, our preference is to provide kanohi ki te kanohi services, absolutely. But at the same time, we're very conscious of the fact that there are vast numbers of whānau who aren't getting anything at the moment. So we made the decision to convert this program for now to an online 8-week program. And so we have this 8-week video and interactive module on our website with supervised by a clinical psychologist. So she has Zoom drop-in sessions. Whānau are given pre-post interviews. And we intend to run an 8-week face-to-face program as well. But with this online program, we hope to be able to provide this service to families who cannot access anything at the moment. So hard to reach places or for which services are completely under the pump. So as I said, it's currently for whānau. We're running a pilot for whānau who are managing ADHD. But we also realise that when we've worked with whānau who, because we've got such a strong focus on managing emotions and managing behaviour, that we are sort of thinking transdiagnostically. So next year we're going to run this program to see if it might help kids transdiagnostically, so opening it up to see if it might help any kids managing anxiety or emotional behaviour regulation difficulties. So just a little bit around our sort of how we're navigating our bicultural research space, because I think that's really important to talk about as well. I mentioned earlier that, ACT hasn't come from Western psychology, so that's important to reiterate. But we have some Western psychology in terms of what we're integrating. And so we're sort of integrating Taoist, Buddhist, Western psychology and mātauranga Māori under a He Awa Whiria model. It was developed by Angus McFarlane from a kaitahu researcher down at the University of Canterbury, who described this model as a braided rivers approach in which mātauranga Māori and other knowledge is interwoven in an equitable way, much like a Canterbury braided river, so that there are baskets of knowledge shared equally and upheld equally as well. We also really focus our research model utilising the whānau model, because, you know, when we make decisions around, for example, whether we turn to an online model of our delivery, we think about equity of access to services versus an ideal world in which we can provide face-to-face services. So yeah, if you want to have a wee look, we're still, well, we're up and running now, but we've pretty much filled our spaces in 5 days. There's obviously quite a lot of demand for whānau managing ADHD throughout the country. But next year, as I said, we're hoping to expand this to a much larger pool of whānau, to 120. The really heartening thing for us is that through word of mouth, over half of our whānau that we've recruited are whānau Māori. So that's awesome. Yeah. So I managed to get through everything. Apologies for throwing so much information at you, but I think ACT for kids and researchers, it's a lot. I just noticed a few comments, questions.
I think we'll have to just leave it there.
Yeah.
Mairin, many of us have other things to go on